Do you feel that citizens as well as politicians like yourself can use the conversation as a tool to hold government accountable?
Yes, but we're also going to have to start another conversation, which is with people, which will be a conversation of protest, a conversation of providing and presenting alternatives in the public system leading to the 2009 election. If that's the case, that the government will have heard from people and then ignore their views, then the only thing left for people to do is to throw out the government.
What would your response be to a lot of people, and it came up in the conversation, it was brought up that we'll just say about 90% of the people didn't in the Burnaby Forum want to see privatization of healthcare or a mixed system, and there is the 20 other percent that reflect wanting options. It doesn't necessarily mean privatization. It could be mixed or whatnot. So how, when it comes to policy, is that going to be managed if the majority don't want to see any form of privatization?
It's going to be a big challenge, and along with some other areas, this is one where people will use words that if you attempt to get them to define them, you find that maybe they mean something different. So, for example, someone might say to me, well, I don't want to see any private interest in healthcare at all. And I say, well, that's fine, but by that, do you mean that we shouldn't have doctors' offices? And they are very taken aback. Well, what do you mean? Well, a doctor's office is essentially a private business. They run with overhead. They hire their own staff. They make a profit. Our laboratory services in British Columbia, for as long as I can remember, have always been operated privately, never publicly. And so really it comes down to asking ourselves, what do we mean by public? What do we mean by private? So, for example, I've had people who will say, I want to make sure we have a public healthcare system. And when you ask them to define that and tell you what they feel, what they value, what it means to them the most is that they want to know that when they take their care card and they go to that point of service, that they are going to be able to use that care card and receive service no matter whether they're rich or poor or from a high-class area or a low-class area. So it's really going to be about taking a look at what people mean when they use words like public or private.
Today, this very day, in Victoria, the Premier is announcing a new project for Royal Jubilee Hospital. That project will be a P3. The City of Victoria and the Capital Regional District will be expected to contribute to that P3, but it's the Premier alone who made the decision to use a P3 model, a public-private partnership, and not to have the public sector build that hospital wing itself at a lower price. And so people in Victoria don't support that. The region doesn't support that. The locally elected municipal politicians don't support that. And yet the Premier, on his own will and his own whim, is imposing that decision. Similarly in Surrey, the new health centre in Surrey, the Fraser Health Authority, people involved in the community said no to a P3, a public-private partnership, and the minister and the government simply ignored them. So, you know, public consultation and discussion is not a whim. It's not a project. It's an ongoing exercise. And the government has decided to use the conversation on healthcare, it's the Premier's conversation on healthcare as an exercise to say that it's interested in listening to the public. But if you're interested in listening to the public, it's not just during these confined periods that you do it. You have to do it all the time. It's like being a Christian on Christmas Day. You know, if believing in consultation has to be an ongoing process, and everything the Premier has done on healthcare indicates that he's not interested in listening to people.
So would you say that the conversation, if the government could use the conversation as a way to start a new relationship as listening to the public, but we've yet to see it? And
well, yeah, if they were serious about that, they wouldn't have launched a propaganda campaign, for starters. They wouldn't have questions that frame the debate that are biased and drive people to support certain conclusions. They would attend the meetings. The Minister of Health would actually sit there and listen to people and engage with people and answer questions from people rather than going in, giving a speech and leaving. And that there would be some role for people, real people, in the decisions that are made. All that's going to happen here is that we're going to report back all of the conversations that took place. They're just going to send them over to the government. And then the government's going to make all the decisions anyway. And there will be a debate about whether they followed what people wanted or not, and the government will say they did, and others will say they didn't, right? But there's no role for the people in after the conversation ends, and so it's just then it becomes just an exercise without meaning, if there isn't ongoing engagement, and there isn't, and that hasn't been the Premier's approach to this issue up to now.
And just one final thought: do you have any message that you would like to put out to the citizens of BC, and because there's still conversations going on, and there's still other means of being involved in the conversation?
This is an opportunity to speak directly to government about your ideas, your solutions. I've said to many a crowd that what we want to hear is the kind of things that you yell at the television set when you watch the 6 o'clock news and you say, yeah, how come they don't do this? Why didn't they think of that? We want to hear those things, and so I would just encourage everyone to take advantage of the many ways in which they can provide those thoughts to us, and not to let this opportunity go by, because we are going to be making some fundamental changes in our healthcare system in British Columbia, and we need the voices of British Columbians to help guide that.
Thank you very much. What would your final thoughts be, and what would you tell citizens that you think we should do? As you said, participate. I know there's the upcoming conversation in Vancouver, but what else can they do?
Well, I think they need to get involved in organizations like the BC Health Coalition, who are involved in public health care and support public health care. This is going to be an important debate, and they need to have their voice heard, both by writing, speaking, taking part in demonstrations if necessary, and letting people know at every level that they don't accept the Premier's view that our healthcare system is too expensive, that it's too expensive to have healthcare for everyone, it's too expensive for all of us to share the risk in healthcare and to share the benefits, that we don't want a two-tier healthcare system. This is going to be a fight over the next 2 years. The Premier is committed, I believe, to a two-tier healthcare system, is committed to cutting healthcare services for most of us, and to allowing those with the most money to get superior access to health care. And if we want to oppose that, if we want to oppose this drift to an American model of health care, people's voice is going to have to be heard.
Thank you.
Thank you.
So we ran out of time, but I'd like to thank everybody for participating in the conversation in Burnaby. Thank you.
Thank you.